Hello, everyone, and welcome to this session. I'm going to talk about two oral presentations at ISTH. And the first one is a presentation that I did together with my colleagues. It was on bleeding factor VIII activity and safety 3 years after gene transfer with valoctocogene roxapavovec. As you know, in the study, the GENEr8-1, which is a global open label study, we enrolled 134 intention to treat participants who received 6 times 10 to the 13 vector genome per kilogram of valoctocogene roxapavovec dose to prevent bleeding. We evaluated their factor activity as well as their bleeding event 3 years post gene transfer. And the question is, what were the results? The results showed that a single infusion with valoctocogene roxapavovec resulted in 83% reduction in treated bleeds overall when compared to baseline. The results all further showed that there was a 97% reduction in factor VIII usage overall when compared to baseline. We also wanted to know the number of patients who went back onto their prophylaxis. Out of the 134 patients, 17 in fact returned to prophylaxis, and this was actually a decision that was taken due to multifactorial factors. Some of these factors included the factor VIII activity level, their bleeds, their desired physical activity, as well as, of course, the personal preference. One of the secondary endpoints in the study was the evaluation of the quality of life, and what we found was that there was significant, meaningful improvement in the quality of life of these patients, which was maintained over the 3-year period. The second abstract oral presentation at ISTH was along the same lines, looking at the GENEr8-1 results, but specifically looking at the initial results of patient-reported outcomes, burdens, and experiences probe in this intention to treat patient population. This was an initial analysis of the GENEr8-1 study in which Mark Skinner and colleagues described patient-reported changes from the probe questionnaire, which was a tertiary endpoint for the GENEr8-1 clinical trial. Well, what were the results? Valoctocogene roxapavovec led to a quantifiable change in patient-reported outcomes 2 years after a single infusion with valoctocogene roxapavovec. There were also improvements that were observed in patients' health and quality of life outcomes. Probe score changes were generally consistent with the other quality of life tools that we are familiar with, such as the EQ5D5L, as well as the HEMACOL results. And of course, the study concluded that further studies and analysis are needed to define the threshold of clinically meaningful changes in the probe score. And in fact, overall, these results, in fact, are very much promising in terms of this probe questionnaire being used to evaluate the patient-reported outcomes. Thank you very much.